Topping today's HealthCast, a closer look at one of the key causes of recent food recalls, listeria contamination. Local 10's medical specialist Christy Kruger in the newsroom with the details.
And while listeria is not really a common foodborne illness, it is a potentially deadly one. So people who get sick from this bacteria need to be hospitalized right away to prevent life-threatening blood infections.
Most people that are infected with listeria have no symptoms. It doesn't cause any problem. However, in certain subpopulations, they're at high risk for what we'd say invasive listeria infections. And generally, this is the very young, the very old, pregnant women, as well as people who are immunosuppressed.
All right, so to prevent listeria contamination at home, start in the kitchen by keeping your cold foods cold and the hot foods hot, along with washing and scrubbing food before you chop or prepare them. And of course, remember to wash your hands often because that prevents cross-contamination. Also in today's HealthCast, a closer look at a difficult decision some women are making to reduce their risk of breast and ovarian cancer. Local 10 medical specialist Dr. Soffer has details in his Second Opinion report.
The same week, Anila McGinnis was preparing to undergo a prophylactic mastectomy. She was diagnosed with breast cancer. Once she tested positive for the BRCA gene mutation, she knew she was at high risk.
There's a certain point where you come up against that wall and go, all right, am I going to keep getting checked every 6 months, or am I just going to remove them?
When Julie Klein tested positive for the BRCA mutation in September of 2011, she decided to act immediately.
The first week of November 2011, I had what's called a bilateral salpingo oophorectomy, removal of both ovaries and both fallopian tubes. 2 months later, January of 2012, I have my double mastectomy.
Patients often ask us, can I wait, can I wait? We don't want them to wait until it's too late.
Dr. Brian Slomovitz says studies have shown that in women with a BRCA mutation, removing tubes and ovaries can reduce their risk of ovarian cancer by 96% and the risk of breast cancer by 50%.
Our recommendations for prophylactic surgery are the age of 40 or once they completed childbearing.
Anila isn't waiting.
The ovaries, that feels like a gun to my head at this point, because I already got cancer.
There are several historical factors involved in deciding whether you should be tested for the BRCA gene mutation. Among them, a strong family history of breast cancer, a history of male breast cancer, and Jewish ancestry also increase your risk. With your Second Opinion, I'm Dr. Soffer.
And an organization called FORCE, which is Facing Our Risk of Cancer Empowered, was created specifically for people fighting hereditary breast and ovarian cancer. For more information, look for this story in the health section of our website, which of course is local10.com. Victor?
All right, Christy, thank you. And all new at 5 o'clock, there are hundreds of animals looking for loving families right here in South Florida.